My name is Elena Valassi. I am an endocrinologist and a clinician scientist at the German Trias Pujol Hospital and Research Institute in Barcelona, Spain. And this is an educational webinar for the Cushing Awareness Day titled Perspectives from People Living with Cushing Disease and Healthcare Professionals. So what is Cushing disease? Cushing disease is a condition caused by a generally small, benign tumor located in the pituitary gland. The pituitary gland is a small gland situated in our brain, which produces so many hormones, which are very important for many functions of our body because they control many aspects. Hormones are chemical messengers, and among these chemical messengers, pituitary gland produce also ACTH. ACTH is an important hormone which goes into the circulation and goes to the adrenal glands, stimulating the production of cortisol and other essential hormones which control energy, blood pressure, blood sugar. So when there is excessive ACTH production from the pituitary gland, there is also excessive cortisol, and this is precisely Cushing disease. Cushing disease is a condition characterized by excessive production of ACTH from the pituitary gland and consequently too much cortisol in our body. And as a consequence, patients suffering from this condition present with several signs and symptoms of the disease, such as weight gain, muscle weakness, and bruising easily. So this survey included 98 patients, which kindly accepted to participate, and also 51 endocrinologists, because actually the main goals of this survey were from, on the one hand, understand everyday Cushing disease experiences and care, so patient perspective on that. And on the other hand, also compare the perspectives of patients and endocrinologists on topics such as symptoms and quality of life. And of course, the ultimate goal was to generate insights to improve care and treatment. So we know very well that the journey, so the patients experience a long journey across all the phases of Cushing disease. There is the first phase, which is characterized by early symptoms of Cushing, which are often unrecognized or under-recognized, and certainly the cause of this is not clear. This is particularly frustrating for the patients. The burden of symptoms progresses and increase constantly. And then finally, patients reach the correct diagnosis, but this opens to many other challenges. And then, of course, there is the treatment phase, which we know very well is not always definitive. There are multiple treatments that could be necessary. And also there is an important burden of complications after successful correction of hormone excess. So all these generate clear unmet needs. And as I said before, the main goal of this survey was just to try to identify most of these unmet needs. Patients go through a very long journey that starts with the appearance of early symptoms and then go to, an increasing burden of the symptoms themselves. And then they have to reach and to get the correct diagnosis. There are many challenges again there. And then there is all the, again, challenging phase related to the treatments and the complications of that. So all these generate unmet needs, especially in terms of early symptoms. Patients experience sudden weight gain and tiredness, but also bruised skin, muscle weakness, and mental health issues such as brain fog, depressive symptoms, issues in attention and memory. And actually the results of the survey reflect the substantial physical and psychological burden of the patients. And as we can see here, there are many symptoms that are indicated as bothersome by the patients, including weight gain, fatigue, skin alterations such as thin skin and easy bruising, muscle weakness. There is all the aspects, as I said before, of mental health with cognitive impairment, memory issues, emotional distress, sleep problems, problems in sexual life. And as we can see here, the endocrinologists were asked to indicate what were the most bothersome symptoms for their patients. And we can see that they perceived all Cushing symptoms as even more bothersome than patients. And this is somehow positive because it indicates that the physician maintain a high level of awareness of the elevated burden, the elevated symptom burden for their patients. So this is certainly positive. And then in terms of the increasing burden of the symptoms, as I said before, the long journey the patients experience before getting the correct diagnosis. So we can see that most of them received the diagnosis precisely by from the endocrinologist. And also endocrinologists recognize, of course, that the journey to reach the diagnosis has been long, but probably they don't have the right perception of how long it is, because 60% of the patients declare that diagnosis took 3 to 10 years. So it's definitely a long time. So endocrinologists recognize that the long delays is probably due to several factors, including low disease awareness. And unfortunately, this is a common problem in rare disease. It's very important, for example, that the primary care physician, the general practitioner, increase the levels of suspicion related to this disease. And no specific symptoms also do not help, because, for example, weight gain or sleep troubles could be attributed to the stressful life we all conduct nowadays. And we know very well that diagnostic tests are not perfect, sometimes are not reliable, can be conflicting. So these, of course, also contribute to prolong the time to reach the diagnosis. So patients experience so many visits with different specialists, or are seen by different specialists who sometimes, or often actually, miss the correct diagnosis. So this can be particularly confusing and exhausting for them, frustrating. And they also declare that they often felt misunderstood, judged, or blamed, and these contribute to further increase their anxiety about the future. So definitely diagnosis, as I said before, can be a confusing journey with many emotions involved, which even can lead to self-doubt on the patient side, and they need the continuous doctor assurance on their side. From their point of view, physicians feel that this is a particularly crucial moment, because there are differences in doctor and patient experience, and this can impact the trust and impair actually the patient-physician relationship. And then as the diagnostic journey, we can see continues, this further produce intense symptom burden and distress. And patients often request a test or referrals and may not get it. And endocrinologists recognize that this particular attitude, this particular very well justified frustration can create some tensions in the care relationship. And then finally, when testing starts, patients experience fear and hope at the same time, which is totally understandable. And when finally the diagnosis is established, patients feel a dual feeling. So on the one hand, they feel relief, of course, because finally they can give a name to their suffering, but on the other hand, also anger for all the time that has been lost, and also grief. Actually, this is an important phase because it's the acceptance phase. On the other hand, the endocrinologist recognize that patient can feel that are not taken seriously, and they recognize that there are several expectations. So it's crucial to communicate to their patients what is the Cushing disease, what are the implications, what are the complications, and that the journey has not come to an end because it's still longer. So the emotional support is key in this moment and should be provided at diagnosis to all patients. So here is a summary of what we have said until now, and the main concept we should emphasize is that the diagnosis is a confusing journey, and there are so many emotions involved, coming from something isn't right to frustration, dismissal, erosion of trust, and also emotional ups and downs. So some contradictory feelings, but I think that patients should be aware that this is totally normal and that is experienced by everyone. And endocrinologists overall are quite aware of this. So, and then what happens after surgery? So in terms of treatment, what is the perception of treatment efficacy across Cushing symptoms? So here we can see a clear discrepancy between the patient perception and physician perception, because patients feel that effectiveness of treatment is limited and the burden of the symptoms is still there. So there is some improvement, but certainly not a complete normalization, especially in terms of weight gain, fatigue, muscle weakness, cognitive impairment. But as we can see here, it's quite evident that physicians are overly optimistic about the effectiveness of the treatment, and they feel that most of the symptoms are under control, and it's not the case. So, as a consequence of this, as a result, the patient satisfaction regarding treatment is limited, and there is definitely room for improvement. And then, so we arrive here. So what is the perception of patients regarding treatment and surgical treatment? So they are aware that, of course, surgery help, but wasn't always the cure, even in patients who achieved the complete normalization of hormone excess. So we can see a kind of biochemical cure. So there is not a parallel, a concomitant clinical cure, and the symptoms are still there. In some cases, even may worsen as compared with the active phase of the disease. And also, we also know that sometimes surgery is not, only one surgery is not the only treatment that should be offered to the patients, because sometimes they need more surgeries, multiple treatments, and also there is even in case of successful surgery, initial successful surgery, there is a high risk of recurrence. So endocrinologists thought, according to the survey, that treatments were more effective than patients, we have seen before, but are also aware of some limitations. They know that treatments are not perfect, and recognize that there are too few options beyond surgery, and that treatment improves hormone levels, but certainly symptoms can persist or even return. And so what are the top unmet medical needs in patients? So regarding treatment, as we have seen before, weight gain, fatigue, muscle weakness, cognitive impairment, and mental issues are certainly the most bothersome symptoms for the patients, which should receive specific and personalized attention. And certainly in some cases, the endocrinologists recognized that these should be offered to the patients. Sometimes it's not easy to do that, but they also recognize that optimize the control and the treatment of the residual morbidity after treatment is one of the most important unmet needs regarding care, which also severely impact on quality of life of their patients. Especially weight gain and fatigue, there is a concordance between patients and physicians. And more than 50% of responses believed that these two complications were top issues that remain even long-term after hormone normalization. And as I said before, muscle weakness and mental health issues are also important residual symptoms. Our project, this survey investigated the key aspects of living with Cushing, and we can summarize the main messages here. So there are multiple symptoms that affect everyday lives. We could say over all the phases of the disease, especially at the beginning when diagnosis is not established, because there is probably also amplified by the frustration that everything is not properly recognized. As I said before, this increase the burden of symptoms. For most people, endocrinologists were the professionals to diagnose Cushing. So it's important also to work with other specialists in order to increase the awareness of this rare disease in them, especially, as I said before, for the general practitioner. It's very important is a role. And then for patients, surgery is helpful, but wasn't always the cure in all cases. And endocrinologists thought that treatment were more effective than patients' opinion. In summary, living with the Cushing disease has many impacts on daily living. And what are the key areas of impact? According to patient experience, there is a slow, relentless decline as a symptom progressed, not only because more symptoms appears, but also because the pre-existing symptoms worsen. In terms of mental health, they experience and suffer particularly from brain fog, low mood, anxiety, and the loss of self-identity, which is particularly impacting and not always recognized. From a social point of view, these visible symptoms lead to stigma and isolation. This was almost invariably reported by the patient. More than 70% of them perceived that. So the social pressure is an important unmet need. To address that is very important from a psychological point of view. The economic burden of Cushing disease is not always recognized because patients go through financial concern especially due to impact on work, because they are not able in many cases to do the same thing they did before, and this is not always recognized in the work environment, and sometimes at home either. And it's very important also to remember that many patients are on sick leave or on early retirement, and many of them are unemployed. So the economic impact also on their family life is very important. And then in terms of care relationship, this is a turning point in care. When they feel listened to and understood, of course, everything change, because they can build a trustworthy relationship with their physician, and also they feel validated not only by physician but also by their family members, friends, and colleagues. And these are the views from the endocrinologist, the key areas of impact for the endocrinologist. Certainly in terms of physical health, they feel that there is a long-term decline in the physical health of their patients and day-to-day abilities. So quite positive that there is an extensive recognition and awareness of this. They also recognize the broader mental impact of Cushing, but actually few still understood the loss of self-identity. As I said before, this is a very recurrent point for the patients, and it's not completely addressed during medical visits. And the social impact, I think that there is definitely room for improvement for the endocrinologists, because we not always are aware of the stigma linked to symptoms. Only 30% of the endocrinologists participating in the survey recognize that. So the impact of stigma on the social well-being. And also the financial impact was only noted by a few. So definitely we should try to help patients cope with these important phase and important aspects of their disease and important consequence, which also is important for the health system, indeed. And then in terms of care relationship, the endocrinologists recognize the issues with the recovery expectation, the importance of doctors' knowledge and empathy. So this is certainly positive. So, and here, so we can see the double vision. And as I said before, we should make any efforts to make the two perspectives more and more coincident and more and more in line to each other. In summary, living with Cushing has many impacts on daily living, and we can see that there are 5 shared key concerns: delayed diagnosis, limited treatment options. So research should go for that, and actually is going for that. There are symptoms that keep coming back, so an effort should be done also not only to offer new pharmacological options, but also to address within a multidisciplinary team these multiple symptoms. Mental health burden definitely should be addressed and treated, also because all these negatively actually affect quality of life. So it's very important to offer a multi-dimension treatment and approach in order to ultimately improve quality of life. Participants also identified opportunities in areas for change. Of course, they had a very proactive attitude, and these are the opportunities and for change. Try to faster diagnosis and easier monitoring. That will be very important, of course. And according to the endocrinologist, of course, they share the same opinion, and they propose and they indicate that it's very urgent to find the tools to support early and accurate diagnosis. In terms of support that should be offered to the patients, endocrinologists would like to improve long-term support precisely to help patients face the long-lasting complications in terms of physical and mental health. And a special regular follow-ups and access to mental health care should be provided to all patients. And then in terms of treatments that boost energy and improve symptoms are highly demanded by the patients. And according to the endocrinologist, it should be made an effort to improve treatments and to find new treatments that keep cortisol in a healthy range and reduce side effects, so increase the effectiveness and the tolerability of the drugs, according to the endocrinologist. And then in terms of the awareness, of course, it's important to foster greater awareness among family doctors, to prompt earlier suspicion of Cushing, because in more than 90% of the cases, of course, is the first doctor, is the first health professional seeing these patients for their early symptoms. And then the empowerment is also very important. There is a high need for stronger support networks to navigate stigma and isolation. So thank you very much for your attention.